or by using a normal pen. Usually we compare pen prick on both sides of the body. We compare pen prick in the left hand with pen prick in the right hand, pen prick in the forearm with pen prick in the other forearm, pen prick in one side of the forehead with pen prick on the other side, pen prick on one side of the patient's cheek with pen prick on the other side, and pen prick on the patient's chin with pen prick on the other side. And we do the same comparison in the lower limbs, comparing pen prick on the foot with pen prick on the other foot, and pen prick on the leg with pen prick on the other leg, and so on. After comparing pen prick on the two sides of the body, we compare pen prick in the lower parts of the body with pen prick in the upper parts of the body. We compare pen prick in the foot with pen prick in the hand, for example, with pen prick in the face. And we do the same thing on the opposite side. And in every case, we ask the patient whether there is any difference between pen prick on both sides or between pen prick on the lower parts of the body and pen prick on the upper parts of the body. If there is a side-to-side difference, we try to find out evidence of hemi-hypoalgesia or hemi-analgesia. If there is a difference between pen prick in the lower parts of the body and pen prick in the upper parts of the body, we try to find out any evidence of a sensory level by testing pen prick on the peripheral parts of the lower limbs, on the feet, and on the leg, on the thighs, on the abdomen, until we determine exactly the sensory level. We proceed then to examine touch sensation. We examine touch sensation in the same way by comparing touch on both sides of the body. And it's better to ask the patient to close his eyes and compare touch on both sides of the body, starting by the face, then the upper limbs, and then the lower limbs. And in every case, we ask the patient whether he is perceiving touch sensation or not. Touch sensation is tested using a brush or a piece of cotton or gauze. Then we shift to examine temperature sensation. Temperature sensation is examined using test tubes containing cold and hot water, and we ask the patient to close his eyes, and we touch different parts of the body with the cold test tube one time and with the hot test tube another time, and we ask the patient to tell us what temperature he is perceiving, whether it's cold or hot. And we compare both sides of the body together. We proceed then to examine the deep sensations. Examination of the deep sensations includes the following: examination of the vibration sense, examination of the position sense, and the examination of the sense of movement. Examination of the vibration sense is done by the tuning fork. We use a tuning fork of 128 cycles per second, and we put the handle of the tuning fork on the bony prominences and ask the patient whether he feels vibrations or not. And we compare vibration on both sides. For example, we start by testing vibration on the medial malleolus of one leg, comparing it with vibrations on the medial malleolus of the other leg. Then we compare vibration sense on the tibial tuberosity of one lower limb, comparing it with vibration on the other tibial tuberosity. Then we proceed to compare vibration on the anterior superior iliac spine. By comparing vibration on the anterior superior iliac spine on one side with vibration sense on the anterior superior iliac spine on the other side. Then we proceed to compare vibration sense on the clavicle of one side with vibration on the clavicle of the other side. We can compare even vibration on the mastoid process on one side with vibration on the mastoid process on the other side. In the same way, we can test vibration sense on the spinous processes, and we can test them over the phalanges of the toes or the phalanges of the fingers and thumb, and we can compare vibration sense over bony prominences anywhere in the body. As a matter of fact, vibration sense is the most sensitive test for posterior columnar affection. That's to say, in mild cases of deep sensory loss, vibration sense is the most sensitive test for impairment of the deep sensations. The next test for deep sensations is the so-called the sense of movement. We ask the patient to close his eyes, and we hold the big toe between the thumb and index finger this way, and we move it gently, and we ask the patient to tell us when the movement of his big toe just starts. And we repeat the test on the other side in the same way. The next test for deep sensations is the so-called the sense of position. The sense of position is done by asking the patient to close his eyes, and the examiner holds the patient's big toe between his index finger and thumb, and put the big toe in a position of plantar flexion one time and in a position of dorsiflexion another time, asking the patient each time to tell the position of his big toe. We repeat the test on the other side. In cases of sensory ataxia, such as tabes dorsalis, position sense, vibration sense, and the sense of movement are all impaired. Then we proceed to examination of the cortical sensations. The cortical sensations include the following: tactile localization, tactile discrimination, stereognosis, sensory inattention, or the so-called perceptual rivalry, and graphosthesia. We will start by examining tactile localization. Tactile localization, that is the ability of the patient to localize the site of pinprick with his eyes closed. We ask the patient to close his eyes at first, then we prick him in one of his fingers and ask him to point with the index finger of the other hand to the site of pinprick. And we repeat the test on the other side. To test the ability of the patient to localize the site of stimulus exactly. In cases with cortical sensory impairment, tactile localization is impaired, so as the patient might point to another finger other than the stimulated one. The next test for cortical sensations is the so-called tactile discrimination or two-point discrimination. Two-point discrimination is done using two pins and performing pinprick in 2 points with the patient's eyes closed, and we ask the patient to tell whether he is stimulated in 1 point or in 2 points. Of course, the patient's ability to perceive 2 points of stimulation or 2 pinpricks done at the same time differs in different parts of the body. For example, he can perceive 2 points on the dorsum of the hand or on the dorsal aspect of the fingers at few millimeters apart, whereas on the thigh, for example, he can only perceive 2 points of stimulation as 2 stimuli when they are apart from one another by maybe a few centimeters. So the discrimination of 2 pinpricks done at the same time differs at different regions of the body. The most sensitive parts are the fingertips and the tips of the toes. The next test for cortical sensation is the so-called stereognosis. Stereognosis is done by asking the patient to close his eyes and putting an object on his palm and asking him to recognize this object. We can repeat the test on the opposite side using another object, asking the patient to close his eyes at first, and we put another object on the palm of his hand and we ask him to identify what object he is holding. There it is. In